masses. Masses over the abdomen. So what are all the different masses that you can have? These masses can be due to inflammation, it can be due to an abscess, or it can be due to neoplasm. So any of the three things that can be there. Okay, so what are the different masses that you can get? So number one thing, A, if it is a right upper quadrant mass. Okay, if it's a right upper quadrant mass, what are the possible things that the patient may be suffering with is, number one is called as hepatomegaly. Okay, hepatomegaly, this can be either due to hepatitis or any tumors or any carcinomas like hepatocellular carcinoma. Okay, then the right upper quadrant mass can also be a distended gallbladder. Distended gallbladder during cholecystitis. Okay, then it can also be presented during a pancreatic cancer. Okay, so these all can be the right upper quadrant mass. Then what else we do have? What if there is an epigastric mass? Okay, if there is an epigastric mass, the number one thing is it can be a pancreatic cancer, or it can be a pancreatic pseudocyst. Okay, it can be an acute gastric distension also. And it can be an aneurysm of the abdominal aorta as well. Abdominal aortic aneurysm. Okay, these are all things that can present as an epigastric mass. Moving on to the left subcostal mass, or you can say left upper quadrant mass. So see, left subcostal mass. Okay, left subcostal mass, what you can see, it can be majorly, it will be just a splenomegaly. Okay, then moving on to the right lower quadrant mass. Okay, so right lower quadrant mass, it can be an appendiceal abscess, and it can also be a cecal carcinoma as well. Cecal carcinoma. Okay, then what do we have? We are left with left lower quadrant mass. Left lower quadrant mass. Okay, what can it be? Left lower quadrant mass, it can be a diverticular abscess. Okay, it can be a diverticular abscess, it can also be sigmoid colon carcinoma. Okay, then moving on to the hypogastric mass. So what does the hypogastric mass indicate? Mainly the hypogastric mass will be due to a pelvic pathology. Okay, then what if there is an central abdominal mass? Central abdominal mass. So if there is a central abdominal mass, it will be majorly an aortic aneurysm. Okay, so these are all the different any abnormal mass it indicates. So if there are masses, mainly the masses will be due to inflammation, or it will be either an abscess or an neoplasm. So if it's an right upper quadrant mass, it will be hepatomegaly, mainly due to hepatitis, tumors or hepatocellular carcinoma. It can also be due to a distended gallbladder, which is cholecystitis, due to cholecystitis, or it can be presented due to pancreatic cancer. If there is an epigastric mass, it majorly indicates pancreatic cancer or a pseudocyst. It can bear an acute gastric distension or an abdominal aortic aneurysm. If there is a left subcostal mass, it will mainly a splenomegaly. Okay. If there is a right lower quadrant mass, it is due to appendiceal abscess, cecal carcinoma. If there is a left lower quadrant mass, it can be due to a diverticular abscess or a sigmoid colon cancer. If there is a hypogastric mass, it will be mainly due to a pelvic pathology. And if there is a central abdominal mass, it is majorly an aortic aneurysm. So these are all the things that we look at during the inspection of the abdomen. Okay. Next, moving after inspection, we are going over palpation. After inspection, we have palpation.